If your doctor has diagnosed you with cataracts, you probably have a lot of questions. Let's take a closer look at how cataracts develop and how you can achieve clearer vision. Cataracts are a natural part of aging that affect nearly everyone by the time they're 65. The most common cause of cataracts is protein buildup in your eye's natural lenses, which leads to clouded, blurred, or dim vision. As the buildup increases over time, the lens becomes cloudy and blocks light from passing through. It's kind of like trying to look through a foggy or frosted car windshield. With your cataract surgery, you have an exciting opportunity to renew your vision and see life clearly again. Over 4.2 million cataract surgeries are performed in the U.S. every year, making it one of the most common surgical procedures. The procedure, which involves removing your eye's natural lenses and putting in replacement lenses, typically takes 10 to 15 minutes, plus 1 to 2 hours for recovery. Cataract surgery has a high rate of success, with most patients experiencing improved vision soon after surgery. During the first step of your cataract surgery, your surgeon removes your clouded lens through a tiny incision. Your surgeon then replaces your original lens with a new artificial lens. With this lens, you'll be free from cataracts. And if you experience other vision conditions, like astigmatism or presbyopia, it's possible to correct those during cataract surgery too. The cataract replacement lens you choose impacts what you can see and do post-surgery. Monofocal lenses are basic cataract replacement lenses that help reduce your need for glasses at far distances, but you will still need glasses for reading and other activities. If you have presbyopia, you're likely noticing a reduced ability to focus on nearby objects. This is caused by the gradual stiffening of your natural lens. Presbyopia-correcting lenses are designed to help reduce your need for glasses at all distances. Whichever lens you choose, cataract surgery is an exciting step on your journey toward a brighter, clearer future. Ask your doctor about your lens options and get ready to live clear of cataracts.